Hello and what's up, beautiful people? This is your tooth doctor, Maureen Mora here. Welcome back again to my YouTube channel. All we do is talk matters oral health, and it is simply because I do believe everybody is entitled to good oral health status. And guys, if you happen to having a child, do their teeth look something like this? If so or not, stay tuned as we look into details why they look like so and what are some of the things the key important things that we're gonna do not to make them look like that, or if they're already like that, what do we do now? So basically, babies' teeth are very brittle. So their tendency at which they can acquire cavities is very high compared to the adult's teeth, because even with a simple comparison of the enamel structure, for the baby's teeth, it's usually very thinner, whereas for the adults, it's a bit thicker, and that can make them, even the rate at which the cavities can progress, to be a little bit lower. So guys, I'm going to have a Q&A session to help me tackle today's topic, which is early childhood caries. Early childhood caries, which is a topic I want us to get into today. You find that this is one of the most common infectious diseases in childhood. And they usually have a significant burden and long-term consequences, especially to your baby's teeth and general well-being. So what is this early childhood caries? This is a multifactorial condition that is due to interaction of things like taking consuming diets that are high in sugars, not brushing your teeth well, not getting good exposure to fluoride, and even if you have enamel defects. Also, there are a lot of terminologies that your oral health caregiver can choose interchangeably to relate to early childhood caries, and they include like nursing caries, nursing bottle caries, milk bottle syndromes, baby bottle caries, or even rampant caries. So these are some of the terms that your dentist or your oral health caregiver might use to refer to these early childhood caries. So most of the commonly affected teeth by early childhood caries, actually all the teeth can be affected. However, the most susceptible teeth are the upper four anterior teeth. In most circumstances, the lower ones are less likely to be affected because of the protection from the tongue and the salivary glands around that area, so it can create some cleansing on the teeth. So, some of these signs that you can watch out include your child not wanting to eat as usual, or you can notice some pimple around either one or two of the teeth. Also, you can check on the child's tends to put their tongue more often inside the mouth than usual. Also, the teeth can start to become darker. And the last one is you can find the teeth are starting to have some cavities. So these are good signs to always watch out. And anytime you notice something unusual, make an effort to contact your oral health caregiver or dentist. So some of the effects that can be caused by early childhood caries include pain to thermal changes, meaning when they consume hot or cold foods. You'll also find them they're more irritable than usual. Some children might be having sleeping difficulties. They can also have chewing problems. Anytime you give your child food, they don't want to eat well. They might become, they can lose their weight as well. Reduced appetite is another factor to watch out, or even the school performance, how they perform in school tends also to go down. So those are some of the effects that can be caused by early childhood caries. So please remember, most children might not be in a position to express some of these effects if they are undergoing them. So it is the responsibility of you as a parent to always make regular checkup inside your child's teeth. If you notice there is anything alarming, your dentist or your oral health care provider should be the first person you reach out before thinking of posting on Facebook. The major risk factors include your child sleeping with a bottle containing sweetened drinks like tea, milk, juice, or stuffs like that. So if your child is doing this regularly, then they become susceptible to getting early childhood caries. Another factor includes dietary habits. So here, if again your child is consuming a lot of sugary foods and it happens to be very sticky, it creates an optimum environment in your mouth that can make them susceptible to early childhood caries. Guys, remember, caries hazitambui mtu. Even at a young age, your child can get dental cavities, or as we want to call it, early childhood caries, especially if good oral measures are not kept well into point. So on the management of early childhood caries, normally it is good to start good oral habits at an earlier age. If your child is very young, it is advisable that you always make an effort of cleaning your baby's gums and tongue with a clean piece of cloth. However, if they have some few teeth or all the teeth in the mouth, kindly help them brush their teeth with a fluoride toothpaste at least 2 times daily. Also, limit or avoid feeding them with more sugary foods like biscuits, cakes, sweets, and such like stuff without cleaning their teeth well. Another thing to always try and consider is avoid putting your child to sleep with a bottle in the mouth, because now these sweetened foods, if they stay there for as long as the baby is going to sleep, a lot of science is going to take place on the baby's teeth. The food is going to stick there for a very long period of time. The bacteria are going to feast, multiply, and then they will end up destroying your baby's teeth. Also, if your child is young, parents, try not to feed them while they are sleeping. Wacha wanyonye ama wakule while they are seated upright. And once they are done with feeding, before putting them to sleep, always try and get a clean piece of cloth, clean their teeth, and put them to sleep. Technically, if the early childhood caries is affecting your baby's front teeth and they are not painful or symptomatic in any way, mostly your oral health caregiver will advise you to leave the teeth be. Only that now you will have to level up your oral hygiene measures to this child and avoiding giving them a lot of sugary stuffs which can provoke the teeth ama ifanye hizo meno ziendelee kuharibika zaidi. However, if it's affecting the back teeth, these teeth many a times, they take a long period of time before they are shed off. So if they are having cavities already, your dentist might advise you get them filled so as to retain them until it is their time to be shed off. Some of these teeth, we need them in the mouth at least back at the age of around 12 years. And baby teeth are not just baby teeth. I want you to learn that these teeth, they have an important role they perform in your mouth. They basically maintain the space of the permanent teeth yet to come. So you find that your oral health caregiver has advised a parent that the teeth will need to be restored, and then the parent will be like, no, these are baby teeth. Eventually they're gonna go off. Yes, hatukatai. But then it is not as simple as it looks like. If this tooth is going to be removed at an earlier stage, the gap is going to close up. So by the time the permanent teeth are coming out, they don't have enough space to grow on, they start overlapping. So the next time, try to listen to your dentist, especially if they're giving you such professional advices. So I think that is it from my side today. Till next time, have a good one. Bye-bye. Thank you.